In this video, we're going to be looking at two of the knee stress tests, and those are going to be the Valgus stress test of the knee and the Varus stress test of the knee. Before we get into those special tests, we're going to review a little bit of relevant clinical anatomy here. And one thing I want to preface this video with is that when you talk about the Valgus stress test or the Varus stress test, you have to specify of which joint, because other joints in the body also have tests by the same name. For example, the elbow. There's a Varus and Valgus stress test of the elbow. So to be rigorously correct when you're talking about any of these stress tests right here, you need to say of the knee in this context. And it's also important to remember that the knee joint allows most of its movement in the sagittal plane, that's flexion and extension. It permits a little bit of movement in the transverse plane, that would be internal rotation and external rotation. In the open chain, it would be of the tibia relative to the femur. But structurally, it does not allow frontal plane movement. And the two main frontal plane movements we might consider would be abduction and adduction. Those occur in the frontal plane, and the knee does not permit those movements. And part of the restriction on that are the collateral ligaments. So there's two of them. The MCL on the inside, that would be the medial collateral ligament, and then the LCL on the outside, the lateral collateral ligament. Okay? And those ligaments, along with other structural considerations, forbid movement in the frontal plane. Okay? Well, if you had damage to one of these ligaments, it might allow excessive movement in the frontal plane, movement that's not supposed to occur, and that's what these stress tests assess for. Okay? So before getting into those tests, let's review the meaning of Varus and Valgus. We'll start with Valgus. So a valgus force would be applied to the outside of the knee here and really pushing the knee inward or pushing it medially from the outside. Okay? And if you think about this, let's say it occurs in the open chain. Okay? So that means the tibia is the mobile bone. Pushing from the outside in like this would tend to make the tibia move outward like this relative to the femur, okay, in open chain. So by definition, a valgus force produces abduction at that joint, and that's abduction, abduction, okay? And so a valgus force would come from the outside, pushing in. A varus force, by definition, comes from the inside and pushes out at the joint line. And so again, if this were an open chain, so the femur is static, the tibia is mobile, pushing from the inside out would tend to make the tibia move inward like this, so it would actually produce a deduction. So by definition, a varus force will produce a adduction at that joint. Okay? And we're going to use these forces and take advantage of them to assess for damage to either the MCL or the LCL at the knee. So right here in all of these pictures, we're actually looking at an anterior view of the right knee, not the left anywhere. This is the right side. The patella has been removed in all three of these images for clarity. Okay? So right here on the outside, you see the LCL, and then on the inside here, you see the MCL. Now we'll first look at the case of a valgus producing force. So the valgus force, recall, hits the outside of the knee and pushes inward. Okay? So here's the outside of the knee. It's going to actually compress that side of the knee, but then it's going to elongate the inside of the knee. And if that valgus force occurs with enough strength, that elongation on the inside of the knee can be excessive enough to rupture the medial collateral ligament. And so in general, if a valgus force is sufficient enough, it can rupture the MCL. Conversely, a varus force occurs hitting the inside of the knee. So the inside of the knee will be compressed in that case, but then the outside of the knee here will be elongated. And once again, if that elongation is sufficient enough because the varus force had enough strength, then that LCL can rupture. Okay? So when we do the valgus stress test, we're assessing for excessive joint laxity on the inside of the knee, which could indicate an MCL rupture. And if we're doing the varus stress test, we're assessing for excessive laxity on the outside of the knee, which may indicate an LCL rupture. Okay? So now let's take a look at the valgus stress test of the knee. And remember, the purpose of the valgus stress test is to evaluate for the presence of an injury to the MCL, the medial collateral ligament. So the patient will be positioned in supine with their test side knee, that is the left one here, in full extension. And so I'm the PT, I'm going to firmly grasp the patient's lower leg. I'm doing that with my left hand here. This is going to be my stabilizing hand. And notice that I'm lifting the patient's leg up off the table with the knee straight. It doesn't really matter what angle the hip is here, as long as the knee is in full extension and you have a good ability to exert a valgus force at the joint line. Then you can see here, I'm going to apply the valgus force right on the lateral joint line of the knee. The place I'm applying the force with on my hand is on the web space between my thumb and index finger, which is kind of covered up here. But that's where I'm applying the force, right on the lateral joint line of the knee. And you'll see here, there's a little bit of movement. That's natural. Okay? Everyone's going to have a little bit, which is why when we do this test, we always compare this to the unaffected side, which hypothetically could be her right side here. Okay? Once we do this with the knee fully straight, we're going to repeat the test in about 30 degrees of knee flexion. So there's a number of ways you can do this. I usually just lower their foot to the table. So here's about 30 degrees of knee flexion. And I also move my left hand up a little bit, and I'm going to stabilize this a little closer to the calf, okay, and closer to the knee joint. But I'm still going to use that first web space between my thumb and index finger to apply that valgus force, okay? And again, a little bit of movement is going to be normal here. So a negative test, which is of course normal and indicates a healthy MCL, is going to be painless and there's going to be no associated excessive laxity compared to the unaffected side. A positive test here would be reproduction of the patient's pain, but especially having that excessive joint laxity on the inside of the knee. Now, the valgus stress test has two sets of psychometric values that are assigned to it. One of them is for reproduction of pain, specifically on the inside of the knee, and the other is for excessive joint laxity compared to the opposite side, okay? So if you do this test and it reproduces the patient's pain on the inside of the knee, it has a specificity of 67%, which isn't great, meaning if the test is positive for pain, they have a 67% chance of having an MCL tear. You can see here this test is a little bit better at actually ruling out an MCL tear. So the sensitivity is 78%, meaning if this test does not reproduce pain on the inside of the knee, there's a 78% chance that they do not have an MCL tear. So slightly better at ruling out in terms of pain. It's actually a lot better at ruling out when there's laxity, or I should say not laxity. So when you do this test and you don't find any laxity compared to the unaffected side, there's a 91% chance that they do not have an MCL tear. If there is joint laxity compared to the opposite side, then there's only a 49% chance that they do have an MCL tear. So pretty much with the valgus stress test in general, you're not really so much using it to rule in an MCL tear, you're really using a negative result to rule out an MCL tear, okay? And then finally, we're going to be looking at the Varus stress test of the knee. Now, compared to the valgus stress test, notice that the psychometrics here are terrible, okay? The sensitivity is only 25%, meaning you really shouldn't use a negative result here to rule anything out. And then the specificity is unknown. And part of the reason for these terrible psychometric properties is that an LCL tear is actually really uncommon. If you think about which of these types of forces is more common at the knee, well, it's going to be a valgus force, right? There's already a valgus angle at the knee naturally, right? We all have a natural valgus angle. So that means a valgus force is going to be much easier to reproduce by default, okay? You often see an excessive valgus force when there's a non-contact closed chain rotational injury. That's why an ACL tear sometimes occurs with an MCL tear, because that rotation oftentimes also produces an intrinsic valgus force at the knee, okay? The other reason a valgus force is more common is because if you think about getting hit, let's say in football, somebody tackles you, it's not likely they're going to hit you on the inside of the knee. They're probably going to hit you from the outside, producing a valgus force. So an LCL tear is really not very common, so it hasn't been studied a huge amount. But anyways, the Varus stress test of the knee, its purpose is to assess for the presence of an injury to the LCL of the knee. So the patient will be positioned in supine, as you see over here on the right side, and their test side knee is going to be in full extension. Now, before we go any further, there's a number of ways you can perform this test. The main thing that matters is that you're isolating a varus force at the knee. Doesn't really matter how you get to that. So I'm going to do the test standing over here, and this is mainly so you can actually see the patient's knee. But I could also come around to the other side of the table over here and apply the varus force direct on right here onto the patient's left knee. Okay? Again, as long as you're getting a varus force, it's totally fine. So as opposed to the valgus stress test over here where I was using my left hand to stabilize, I'm actually going to use my right hand to stabilize. And I'm going to do it a little bit more proximally. Okay, so you'll see that in just a second. So we lift the patient's leg up, and here I'm using my right hand to stabilize approximately at the calf. And then I'm going to use my left hand here, specifically the web space between my thumb and index finger. I'm going to use that to apply the varus force. Okay? And also notice that because the patient's lower leg is kind of against my torso here, that's also a little bit of added stabilization. Okay? And then I'm going to apply that varus force at the medial joint line of the knee. And I'm doing it in full extension here. Again, a little bit of movement is normal. Okay? I'm going to do the same thing we did before, repeat that test in 30 degrees of knee flexion. Okay? Again, applying that varus force right at the medial joint line. As you'd expect, a negative test, which would be normal, which would indicate a healthy LCL, is going to be painless, and there's going to be no associated excessive laxity. Therefore, a positive test will be reproduction of the patient's pain, specifically on the outside of the knee. Okay, that's where the LCL is. And then also there may be excessive joint laxity, all right, compared to the unaffected side. Now, as we said at the start of this slide, the psychometrics of this test are terrible, and realistically, you should not use this test to rule in or rule out anything pertaining to the LCL, but understand that it's often used that way clinically. Okay, so just be cautious of interpreting the results. Realistically, though, you might never see an LCL tear. They're extremely rare, but again, if you use this test and it is positive, interpret the results with caution because the specificity is not known.
Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.